Ever wonder what PTSD is and how it affects people's lives? Post-traumatic stress disorder, or PTSD as it's more commonly known, is a mental health condition that's triggered by experiencing or witnessing a truly terrifying event. It's a response of the mind and body to trauma, a personal journey through fear, anxiety, and sometimes a struggle to reclaim control over one's life. Although it's often associated with war veterans, the reality is that PTSD can affect anyone. From victims of sexual abuse and domestic violence to those who've survived natural disasters or serious accidents, PTSD does not discriminate. It doesn't matter who you are or where you come from. If you've been through a traumatic event, you could be at risk. PTSD is a complex and multifaceted disorder, with effects that ripple out into every aspect of a person's life. It's important to remember this. PTSD affects people differently, but it has some common symptoms that we can identify. So, what are the signs that someone might be dealing with PTSD? To answer this, we need to understand the 4 types of symptoms associated with PTSD. Firstly, reliving the event. This can involve frequent, intrusive memories, nightmares, or even flashbacks where it feels like the traumatic event is happening all over again. Secondly, individuals may start avoiding situations that remind them of the event, which can range from places, activities, people, or even thoughts and feelings related to the trauma. The third symptom is negative changes in beliefs and feelings. This can manifest as feeling detached from others, a lack of interest in activities once enjoyed, or even distorted feelings of guilt or blame. Lastly, someone with PTSD may feel keyed up, also known as hyperarousal, which includes being easily startled, feeling tense, or having difficulty sleeping. These symptoms may vary in intensity over time. While these symptoms can be distressing, it's important to remember that triggers can often exacerbate them. What events or situations might trigger these PTSD symptoms, you may wonder? Well, triggers can be anywhere and anything that reminds an individual of their traumatic event. These triggers can be internal or external. Internal triggers are feelings or bodily sensations. For instance, a rapid heartbeat might remind a veteran of the adrenaline rush they felt during combat. External triggers, on the other hand, are tied to our senses and can range from certain smells, sounds, words, or even weather conditions. For a survivor of a car accident, the sound of screeching tires might trigger a flashback. For a victim of domestic abuse, a raised voice might be a trigger. It's important to remember that triggers can be subtle and unexpected, popping up in daily life without warning. Yet they carry the power to instantly transport someone back to a moment of fear and trauma, causing intense emotional and physical reactions. Recognizing triggers is key, but how can individuals suffering from PTSD seek help? So, how does one begin to heal from PTSD? The journey towards healing begins with evidence-based treatments. Cognitive processing therapy, or CPT, helps individuals understand and change how they think about their trauma. It's about retraining the mind to process traumatic events differently. Then there's prolonged exposure therapy, or PET. This involves gradually confronting in a safe way the traumatic memories that you've been avoiding. It's about learning to disentangle these memories from the intense emotions attached to them. Eye movement. Desensitization and reprocessing, or EMDR, uses guided eye movements to help the brain process traumatic memories, effectively reducing their power. Mental health professionals are the guiding light in this journey. They tailor these therapies to fit your needs, helping you navigate through the healing process. With their support, individuals can learn to address their fears, manage their emotions, and ultimately reclaim control over their lives. Therapies can play a significant role in treating PTSD, but what about medications? Is medication a part of the treatment for PTSD? And how can one self-manage PTSD symptoms? Let's delve into this. Medication plays a vital role in managing PTSD symptoms, often working hand in hand with therapy. Antidepressants, mood stabilizers, and anti-anxiety drugs help alleviate PTSD symptoms, enabling you to engage more effectively in therapy. However, medication is only one piece of the puzzle. Self-help and coping mechanisms are crucial in managing daily life. Staying active is a great way to reduce symptoms. Regular exercise releases endorphins, the body's natural mood lifters. Eating a balanced diet fuels your mind and body, while sufficient sleep helps regulate your emotions. Avoiding substances like alcohol and drugs is equally important, as these can exacerbate PTSD symptoms. Remember, it's possible to live a fulfilling life after a traumatic event. Reach out to mental health professionals for help, and start your journey towards healing. Are you feeling alone in your journey towards healing? Remember, you're not alone, and seeking professional help is not a sign of weakness. In this scene, we'll explore the significance of professional guidance and the role of support groups in managing PTSD. Professional guidance is paramount in your journey towards healing. Mental health professionals, including psychiatrists, psychologists, and therapists, have the expertise to guide you through the process of recovery. They can provide an accurate diagnosis, recommend a treatment plan that suits your specific needs, and monitor your progress. But it's not just professionals who can help. Support groups can be a powerful tool in your recovery process. Connecting with others who are going through similar experiences can provide a sense of community and understanding that you might not find elsewhere. They can offer practical advice, emotional support, and a safe space to share your experiences and feelings without judgment. Online platforms, community centers, and healthcare institutions often host these support groups. Remember, it's okay to ask for help, and it's okay to need it. Disclaimer: this video is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider with any questions you may have regarding a medical condition.
Thank you so much for joining me today. If you found this video helpful, please hit the like button and share it with your loved ones. Subscribe for more content on mental health awareness. Remember, there's no health without mental health. Until next time, take care of yourself and each other.